All right, so we're diving deep today into a case report about OAAM in a Brazilian sport horse foal.
Okay.
And I think our listeners are going to find this one super interesting.
Yeah.
It involves a 12-hour-old foal brought to the veterinary teaching hospital at the Universidade Federal de Minas Gerais.
Wow.
And they were presenting with, kind of a constellation of symptoms like a lack of a sucking reflex and stupor.
Oh, geez.
But then there's also this whole other layer of the case where the foal was dismature.
Right.
So, they had like a bulging forehead and floppy ears and like a really thin mole-like coat and lax tendons. And then on top of all of that, they had this palpable prominence on their spine.
Oh, wow. So like right off the bat, there's a lot going on.
Yeah, a lot for the vets to sort through.
Absolutely.
So let's kind of get into it.
Can we
walk us through like that initial exam and what they were seeing?
Sure. So right away, they noted that the foal had tachycardia and tachypnea.
Okay.
And hypothermia.
Uh-huh.
And also recumbency.
So not a good start.
Not a good start, no.
And what about blood work? Like what were they finding there?
So the blood work showed mild anemia.
Okay.
Leukocytosis with neutrophilia.
Okay.
Hypoglycemia.
Got it.
Hypoproteinemia.
Okay.
And then also a partial failure of passive immune transfer.
Ooh. So they weren't getting enough of those antibodies.
Exactly.
From mom.
Yeah.
So basically a critically ill foal with a lot of different systems being affected.
Yeah, a lot of red flags.
So what did the veterinary team do to try and stabilize this little one?
So they immediately started aggressive supportive care.
Okay.
So they established central venous access.
Got it.
For fluid therapy and medications.
Okay.
They started the foal on broad-spectrum antibiotics.
Like what?
So they used ceftiofur and amikacin.
Okay.
They did oxygen therapy to support breathing.
Makes sense.
And then they also did a plasma transfusion to help boost that immune system.
Wow, that's a lot.
Yeah, they really threw the kitchen sink at this.
Yeah, so did all that help?
So there was some improvement. After about a week, he actually regained his sucking reflex.
Oh.
But he still couldn't stand.
Oh, no.
Which was really concerning.
Yeah, I bet.
So at that point, they kind of shifted the focus to a really thorough neurological exam.
Okay, so trying to understand, like, why couldn't he stand?
Exactly.
Was it that prominence on his spine? Was it something else?
Right. Was it trauma? Was it congenital? Was it, even an infection? Like, what was going on?
So what did that neurological exam show?
So they found that he had reduced pupillary and visual threat reflexes, which suggests a problem, in those cranial nerves.
Okay.
Potentially involving the brainstem or even the cerebellum.
Oh, wow.
But I think the most striking finding was that there was this really distinct clicking sound.
A clicking sound?
Yeah, whenever they raised the foal's head.
Oh, that does not sound good.
No, it doesn't.
So what could that indicate?
Well, it just raised even more questions about what was going on.
Sure.
In addition to that, when they helped him to stand, he exhibited tetraparesis. Okay.
Meaning weakness in all four limbs.
Got it.
And also asymmetric ataxia.
So he was uncoordinated, and it was worse on one side.
Exactly.
So at this point, all signs are pointing to his cervical spine.
Right.
So what did they do?
So they decided to take radiographs of the foal's cradiocervical region.
Oh, so they're really trying to get a look at what's going on in there.
Exactly. And that's when things got really interesting.
All right, so let's dive into those radiographs.
Okay.
What did they see?
So they found that this foal had a rare condition called occipitalization of the atlas.
Okay.
So basically the atlas, which is the first vertebrae in the neck, was fused to the occipital bone at the base of the skull.
So instead of having a joint there,
right,
it was just one solid piece.
Yeah, it was just one solid piece.
Wow.
And to complicate things even further, the fusion was asymmetrical.
Oh, no.
So it wasn't even on both sides.
Oh, geez.
And because of that, it resulted in misalignment with the axis.
Which is the second vertebra.
Right, the second cervical vertebra.
Yeah. And so that led to a dorsal dislocation of the axis.
So it's like everything's out of whack.
Yeah, everything's just kind of wonky.
So these findings are really pointing towards OAAM.
They are.
Occipitoatlantoaxial malformation.
Exactly.
So this foal was born with a fused and misaligned neck.
Yeah.
What happened next?
Well, unfortunately, because of the severity of the OAAM and the really grim prognosis, the difficult decision was made to euthanize the foal after 9 days of intensive care.
That's so sad.
It is really sad, but the investigation didn't stop there.
Okay.
They performed a necropsy to really understand the extent of this malformation.
So let's get into those necropsy findings.
Yeah, let's do it.
What did they find?
So the necropsy confirmed what the radiographs showed. The occipital bone and the atlas were completely fused.
Okay.
But when they tried to separate the atlantoaxial joint, they encountered a lot of resistance.
Oh, wow.
And they actually had to disarticulate the head at the atlantoaxial joint instead.
Oh, wow.
Yeah, it was really fused.
So what else did they see?
So they found a lot of abnormalities in the fused bones.
Like what?
So the occipital bone was smaller than normal.
Okay.
The atlas had uneven cranial elements. The wing of the atlas was actually reduced on the right side. And the transverse foramina, which are the openings for blood vessels and nerves, were also reduced on the right side.
So not just fused, but malformed, too.
Oh, exactly. And these malformations had a ripple effect on the surrounding structures.
Okay.
The pericondylar processes of the occipital bone were actually pushing into the fossa of the atlas, which would have made any movement at that joint incredibly difficult.
Wow.
And it gets worse.
Oh, no.
The fusion and misalignment actually caused a reduction in the size of the occipital cerebellar fossa, which is the space where the cerebellum sits.
Right.
And it also led to moderate stenosis of the foramen magnum.
The opening at the base of the skull.
Exactly, where the spinal cord connects to the brainstem.
So on top of the neck problems, there's also pressure on the brain and spinal cord.
Exactly. And remember, this is a newborn foal.
Right.
Imagine starting life with that kind of pressure.
Oh, that's just heartbreaking.
It is.
Were there any other findings in the necropsy?
Yeah, so they also found that the vermis,
The central part of the cerebellum.
had an unusual S-shaped configuration.
So it was deformed?
Yeah, it was clearly deformed.
Wow.
Beyond the OAAM itself, they also found a fractured rib,
Oh, geez.
extensive subcutaneous hemorrhage,
Wow.
pulmonary edema, and bronchopneumonia,
Okay.
and then multiple gastric ulcerations.
This poor foal went through a lot.
Yeah, he really did.
So what about the microscopic examination of the tissues?
So the histopathological examination showed axonal degeneration in the cervical spinal cord, pons, and cerebellum,
Got it.
particularly in the white matter.
Okay.
And this was consistent with Wallerian degeneration,
Which is?
a process that occurs when nerve fibers are cut or severely compressed. And so the separated portion of the axon degenerates.
So irreversible nerve damage from those bony malformations.
Yeah, unfortunately.
And this damage would explain a lot of the foal's neurological symptoms.
It does.
They also discovered marked diffuse splenic lymphoid hypoplasia,
Right.
meaning the tissue responsible for immune responses in the spleen was underdeveloped.
Exactly.
And then they also found mild neutrophilic splenitis,
Right.
indicating inflammation in the spleen.
Yeah.
So we have a Brazilian sport horse foal with a really rare and severe congenital condition
Yeah.
that led to a cascade of issues that ultimately resulted in euthanasia.
Right.
What are the key takeaways for you from this case?
I think this case really highlights that while OAM is most commonly seen in Arabian horses, it can occur in other breeds.
So it's not just an Arabian horse problem.
Exactly.
Okay.
And this was actually the first reported case in a Brazilian sport horse foal.
Wow.
And while we still don't fully understand the cause of OAAM, it's believed to have a hereditary component.
Okay.
In Arabian horses, it's linked to an autosomal recessive gene.
Got it.
But unfortunately, genetic testing for this condition isn't readily available.
Oh, really?
Which makes breeding decisions really challenging.
So even if you suspect OAM, you can't actually confirm it?
Not at this time.
Wow.
No. And that's really the burning question.
Yeah.
More research is definitely needed in this area.
It really is.
Yeah.
This case study provides a lot to think about.
It does.
Even for experienced equine professionals.
Absolutely.
So let's take a moment to break down some of these complex issues a little bit further.
Okay. Sounds good. One thing that's really interesting is the potential link between ICSI and the development of congenital malformations.
Interesting.
So this foal was actually conceived via ICSI.
Okay.
And while we can't definitively say that caused the OAM, there's growing evidence in human medicine suggesting that ICSI might be associated with a slightly increased risk of certain birth defects.
That's a really good point.
Yeah.
ICSI is such a valuable tool in horse breeding.
It is.
But it's not without its potential risks.
Right, exactly.
What about the clinical signs themselves?
Okay.
Are there any red flags that owners and veterinarians should be particularly aware of?
So the clinical signs of OAAM can vary quite a bit.
Okay.
But in foals, you often see things like tetraparesis, which is weakness in all four limbs.
Got it.
Spasticity.
Okay.
And ataxia.
That lack of coordination.
Right. And these signs can be present from birth or they can develop gradually.
Okay.
This particular foal exhibited all three,
Wow.
and his ataxia was asymmetric,
Which is common.
which is a common observation in OAAM cases.
So we can connect those neurological signs back to the damage that was found in the spinal cord and brain.
The compression from those bony malformations led to axonal degeneration,
Right.
which disrupted the transmission of nerve signals.
Makes sense.
And this, in turn, caused the ataxia weakness and other neurological deficits.
So if a foal is displaying those signs, what would be the next step for a veterinarian?
Radiographs are crucial.
Okay.
They provide a visual of the bones and joints in the cervical spine and can often give a definitive diagnosis of OAAM.
And in this case, the radiographs were pretty clear.
They were the occipitalization of the atlas,
Right.
the misalignment with the axis, the dorsal dislocation, all of it was very evident.
Wow.
While advanced imaging techniques like myelography or CT scans
Okay.
can provide additional information about the spinal cord,
Sure.
they're not always necessary for diagnosis.
So radiographs are that first line of defense
Yes, they are.
in diagnosing OAAM.
Yes.
Let's talk about treatment.
Okay.
Is there anything that can be done for foals with this condition?
Unfortunately, the prognosis for foals with OAM is generally very poor.
Okay.
The malformation involves critical structures.
Right.
The skull, the first two cervical vertebrae, and the spinal cord.
Yeah.
Surgical correction is extremely difficult, if not impossible.
So in most cases, euthanasia is the most humane option.
Yes, the severity of the neurological deficits, the potential for chronic pain,
Right.
and the risk of further spinal cord injury all contribute to that decision.
This is heavy stuff, but it's so important to understand these conditions even if they're rare.
I completely agree. The more we learn about these conditions, the better equipped we are to potentially prevent them in the future.
Which leads to that crucial question. Could early intervention or alternative therapies offer any hope for foals with OAM?
That's the crux of the matter.
Yeah.
It's a question that researchers are actively exploring.
We'll have to leave that hanging for now, but it's certainly something to ponder.
It is.
This has been an incredibly informative deep dive into a complex and challenging case.
It has been.
Thank you so much for walking us through it all.
It's been my pleasure.
To our listeners, we hope you found this exploration of OAM insightful. It's a reminder that even in cases with difficult diagnoses,
Right.
there's always hope for progress and new discoveries. Now, here's a thought-provoking question to consider. We've discussed the genetic and developmental aspects of OAAM extensively.
Yeah.
But what about the biomechanical forces involved?
Right.
Could certain management practices, training methods, or even environmental factors influence the severity or progression of this condition?
That's an excellent question.
Yeah.
It really highlights the complex interplay between genetics and the environment in shaping an animal's health.
It's that age-old nature versus nurture debate
Exactly.
that applied to equine health.
Right. And when it comes to OAM, it's likely an intricate balance between the two.
It really is. There's so much more to learn.
Absolutely there is. You know, we tend to focus on genetics as the primary driver.
Right.
But it's crucial to remember that the environment, both during development and throughout life,
Yeah.
plays a significant role as well.
It's that age-old nature versus nurture debate,
Exactly.
but applied to equine health.
Precisely.
Yeah.
And when it comes to OAM,
Yeah.
it's likely an intricate balance between the two.
Right. We know there's a genetic predisposition in certain breeds, but that doesn't tell the whole story.
It doesn't.
There are probably environmental factors both before and after birth
Right.
that can either worsen or lessen the effects of those genes.
Exactly. And this really highlights the need for a more holistic approach to equine health.
I like that.
You know, we can't just focus on genetics or management in isolation. We need to consider the animal as a whole.
Right. The whole picture.
The whole picture, taking into account all the factors that can influence their well-being.
So it's not just about breeding horses with good genes.
Right.
It's also about providing them with an environment
Yes.
that supports their overall health and development.
Absolutely. And that includes everything from nutrition and exercise to
Sure.
stress management and proper veterinary care.
It's about giving them the best possible chance to thrive,
Exactly.
regardless of their genetic predispositions.
Exactly. And when it comes to OAAM,
Yeah,
early detection and intervention are key.
that makes sense.
While we can't always prevent these malformations from occurring,
Right.
we can certainly try to manage them effectively and minimize their impact on the horse's quality of life.
So what does that look like in practice?
Okay.
What are some things owners and vets can do to manage OAM?
Well, it depends on the severity of the condition.
Okay.
In mild cases where the neurological deficits are minimal, conservative management may be an option.
Like what kinds of things?
This could include things like restricted exercise, physical therapy, and pain management.
So helping the horse to live as comfortably as possible, despite the malformation.
But in more severe cases where the neurological signs are pronounced, or the horse is in significant pain, euthanasia is often the most humane choice.
It's a difficult decision, but sometimes it's the kindest thing we can do.
I agree. It's never easy to say goodbye.
Yeah.
But we have a responsibility to prioritize the horse's well-being above all else.
Well said. This deep dive has been both fascinating and heartbreaking.
It has.
We've learned so much about OAAM, a condition that many people, even horse enthusiasts, may not be aware of.
It's a reminder that even in the world of veterinary medicine, there are still many mysteries to unravel.
And that there's always more to learn.
Absolutely. And by sharing knowledge and experiences, we can hopefully make a difference in the lives of horses.
Well, thank you again for joining us on this deep dive.
It's been my pleasure.
And to our listeners, we hope you found this exploration of OAM informative and thought-provoking. Remember from Vet Neuro Jar, keep those minds, inspired hearts light and tails wagging.